Namaskar. I am Dr. Kunjahari Medhi. I am Senior Director in Medanta Cancer Institute, Medanta Medicity Hospital, Gurugram. Today we will discuss about chemotherapy. First, let's know what is chemotherapy. Chemotherapy are the drugs or medicine which are used in cancer treatment. Chemotherapy drugs usually affect the rapidly proliferating tumor cell, which are abnormal cell. But in due course of time, due course of treatment, sometimes it invariably affects the normal cells which are rapidly proliferating cells like hair follicle, intestinal mucosa, oral mucosa and blood cells. And because of that effect, we get the side effects of chemotherapy. Chemotherapy acts by killing the cells, that is called cytotoxic or cell killer, or by inhibiting the growth of the tumor cell, that is called cytostatic or growth inhibitor. Chemotherapy sources may be plant sources, microbiological sources, or chemical, synthetic chemicals, some metals. There are various sources of chemotherapy. Types of chemotherapy. Number 1, curative chemotherapy. When the disease can be cured, cancer can be cured by chemotherapy, this is called curative intent of chemotherapy. Lymphoma, leukemias, choriocarcinoma, germ cell tumor, these diseases are cured by chemotherapy alone. Then neoadjuvant chemotherapy or primary chemotherapy. When tumor bulk is more, so we give the chemotherapy to reduce the tumor bulk, and after that surgery can be done or radiotherapy can be given. So this is called neoadjuvant chemotherapy. Then the adjuvant chemotherapy. When chemotherapy is given after surgery or after radiotherapy to treat the microscopic disease and to prevent the recurrence of cancer. Then the palliative chemotherapy. When there is no cure, at least we can palliate the symptoms, we can control the symptoms by giving chemotherapy. This is called palliative chemotherapy. Then lastly, the life prolongation chemotherapy. That means when advanced stage of cancer is there, when there is no cure, at least we can prolong the life by giving chemotherapy, and we can give a good quality of life and with sufficient prolongation of life. During last 2 decades, there are a lot of improvement and advancement in chemotherapy. Like number 1, there are some newer drugs, newer chemotherapeutic drugs has been introduced, and because of these new drugs, there is better survival, good response and lesser side effects. Then the improvement in chemotherapy formulations. We have nowadays nanotechnology are also used in chemotherapy preparation. So nano drugs, nanoparticle drugs and liposomal pegylated forms. So these are some newer advances in chemotherapy formulations, and because of that the side effects are reduced and the response are improved, and we can give better dose and we get better response with newer formulation of chemotherapy. Third is there is introduction of the antibody drug conjugate. These are the newest version of chemotherapy advancement chemotherapy, where one drug is introduced with a targeted agent. So this is called antibody drug conjugate. The drug is used as a payload, and the targeted agent guide the drug to go inside the tumor cell and that attacks the cancer cell. So this is called antibody drug conjugate. There are various antibody drug conjugates are available nowadays, and there are very good response to these drugs. And there are targeted agents also. So this targeted chemotherapy helps to kill the tumor cell by targeting the molecular targets, like it targets the mutation, it targets the amplification in the tumor cell. The immunotherapy is another form of systemic treatment of cancer, which is not actually chemotherapy, but these are also systemic therapy. And immunotherapy usually activate the body's immune cell, body's T cells, and these activated T cells kill the tumor cell. So, this is the principle of immunotherapy, and nowadays immunotherapy is coming in a big way, and we have been using immunotherapy in various diseases with significant response and with lesser side effects.